it is really important to mention that stroke is a heterogeneous disease. So you have a clot in your vessel producing an ischemic stroke, but where the clot is coming from and why it is there is very diverse. And we do try with our thorough workup during hospitalization, try to identify the most likely cause of stroke. However, that's not always that easy. There are multiple reasons why you can suffer from a stroke. You can have a clot built in your heart, which then goes to the brain. It can be, though, associated also with atherosclerosis, small vessel disease, dissection, vasculitis. So it's a whole plethora of different potential etiologies leading to a stroke. And with the best of our efforts, up to 25-30%, it depends a bit on the type of classification system you look at, we are not really able to identify the underlying cause. But underlying cause is one of the main two pillars of secondary prevention. So you prevent and you prevent the stroke by treating all the risk factors like hypertension, diabetes, and so forth. But on the other hand, you also like to attack the underlying pathomechanism. So you're looking for etiology. So since 25-30% is not really easily identifiable, biomarkers could help to find underlying or most likely underlying causes, and therefore, tailor secondary prevention. So if you look at those patients who have underlying cardiac disease, you could look at biomarkers which are associated with underlying atrial cardiopathy, but also with underlying AFib, which is not yet detected, or also ventricular dysfunction. So every not yet known or covered cardiac source for a stroke. And we're looking into biomarkers to tell us who among the patients are the one we should select potentially to be benefiting from other treatment strategies. In this case, it would be rather probably oral anticoagulation versus antiplatelet, and that's why we're also right now doing an IIT, a randomized controlled trial, investigator-initiated, which is called the MOSES trial, where we're actually selecting patients based on a biomarker we have identified and we have found to be highly associated with underlying atrial fibrillation, but also with the hard endpoint of recurrent stroke. And we select based on this marker, and hopefully we'll find at the end when the study is done that we can show that by guiding secondary prevention based on an underlying pathophysiological mechanism, a surrogate with a biomarker, to improve outcome at the end of the day.